Hello everyone, I'm Dr. Prashanth Reddy. I'm consultant radiation oncologist with American Oncology Institute. Today I'm going to talk about carcinoma of bladder. It is cancer arising from the lining epithelial cells of urinary bladder. What are the symptoms of urinary bladder cancer? Most common symptom is blood in the urine and also increased frequency of urine and painful micturition. In late stages, patient may develop with back pain or shortness of breath or depending on the areas which it has spread. So what are the risk factors of bladder cancer? Smoking is one of the common risk factor because the chemicals which are there in tobacco, they get absorbed in the bloodstream. From the bloodstream, once they get excreted into the urine, these chemicals can cause irritation of bladder and can cause cancer. Other risk factors include exposure to the various chemicals, those who work in certain occupations like people working in textile industry, dyes, leather, etc. and those who get exposed to the arsenic. Increasing age is one of the risk factors. The other risk factors are chronic inflammatory conditions like stones in the bladder or certain infections in the urinary bladder. Hereditary causes like Lynch syndrome is also one of the risk factors for bladder cancer. So how do we diagnose bladder cancer? Once we suspect cancer of bladder, we start with simple urine analysis where we look for malignant cells. If we strongly suspect bladder cancer, then the other important test is cystoscopy, where we pass a scope like instrument into the bladder and we visualize the entire bladder and we can take biopsy from any suspected areas. Once carcinoma bladder is confirmed, then the next step will be to know the staging. To know the stage, we do certain tests like CT scan, MRI and PET scan to confirm the stage of the cancer. How do we treat bladder cancer? Surgery is the main modality of bladder cancer treatment. If the lesion is very small, then we do resection of the lesion, what we call it as PU or BT. If the lesion is very big, then we may have to remove the entire bladder, what we call it as cystectomy. However, radiation is also the other modality of curative treatment. Here, we use very high energy X-rays to treat the bladder cancer. With the advanced modalities like IMRT, IGRT and adaptive treatment, radiation is playing important role in the management of bladder cancer because side effects are very minimal. If patient presents in stage 4, then we have very limited options like chemotherapy, immunotherapy and targeted therapies. Thank you very much.